Hashimoto's disease is an inflammation of the thyroid gland with hypofunction. Let's take a look at this disease together in connection with vital substance medicine. Hashimoto sounds and is Japanese. This has to do with the fact that the doctor who explored it is Japanese. Hashimoto is an inflammation of the thyroid gland. The thyroid gland hangs over the larynx, and when this thyroid gland is inflamed, it produces less thyroid hormones. This has an impact on the whole body. When the thyroid gland does not function properly, certain symptoms will follow. The first thing people feel is fatigue. You can't just get going anymore. You can do whatever you want, it doesn't help. You are tired, you do not have the strength and energy needed for the day. The next symptom is that you are constantly cold. Others around you are warm and take their sweaters off while these people are still freezing. And the third key symptom is a weight gain, which you cannot explain. You eat normally like others and you still gain weight. If you have these three symptoms, I suspect hypothyroidism. And this must be clarified. This Hashimoto's disease is an autoimmune inflammation. In conventional medicine, we assume that the immune system fights against its own tissue. In this case, against the thyroid gland. And that is what causes inflammation. However, the research within integrative medicine clearly show that autoimmune diseases have a connection with the gut. That is why the gut plays a major role in therapy. Let me add something to that. The thyroid gland has a connection or is influenced or controlled by sex hormones. Especially in women, the progesterone, which is a pregnancy hormone, has major effects on the thyroid gland. All women who have PMS, premenstrual syndrome, and this means that the thyroid gland cannot function optimally. Progesterone gets suppressed especially by the pill and by IUDs. I have worked with a lot of women who have Hashimoto's disease, and most of them have used the pill or IUD for 10 years or more. This is a serious side effect, a long-term side effect of these artificial hormones. But now let's look at how to diagnose Hashimoto's disease. The function of the thyroid gland can be checked in the blood. There is a value here. I'll draw it. It's called TSH. This stands for thyroid stimulating hormone. This is a pituitary hormone that stimulates the thyroid gland. Now, the laboratory suggests normal values from 0.3 to maximum 4.8. And if the TSH value is within these normal values, most doctors say the thyroid gland is normal. We don't have to do anything. And I want to show you that this is not true. There is an optimal TSH level and it is around 1.5 to 2.5. Only if the thyroid gland is in this area, you have a normal function. With a TSH value above 3, I suspect a hypofunction. This is somewhat confusing that the higher the TSH, the worse the thyroid gland is functioning. Because a high TSH means that the pituitary has to push the thyroid gland harder for it to produce more. So the higher the worse, and vice versa. The lower the value, the more I suspect a hyperfunction. But that is not the issue today. With Hashimoto's disease, there is always an underactivity, or a relatively high TSH value. Again, values over 3 get my attention. But it is not enough to just check the TSH. We also need to look at the thyroid hormones T3 and T4. And here we have a similar situation as before. Laboratories use different values and the test results are shown on a broad range between minimum and maximum. But again, these thyroid hormones should be in the middle third of these values. This shows a normal thyroid function. If we now have a TSH value above 3 and T3 and T4 are tested lower, a hypothyroidism is actually proven, although everything was within normal values according to the lab. This is the hypothyroidism. If we want to prove a Hashimoto's disease, we still need to measure the thyroid antibodies. There are 3 different antibodies which are measurable. If those values are high, that proves autoimmune inflammation, and only if these antibodies are increased, I can speak of Hashimoto's inflammation. If you now have detected this Hashimoto's inflammation, I still recommend an ultrasound examination of the thyroid gland. There you can see if enough tissue is there or whether parts of the thyroid gland no longer function at all. It is worth doing these further investigations, and in the worst case, you can even follow up with a biopsy. But let's look at how we can treat this. What can be done therapeutically if Hashimoto's disease is detected? Depending on how big the hypofunction is, it requires a thyroid hormone drug. They have many different names. There are some where T3 and T4 are inside. In some products there is only the T4, and the body is then able to produce T3 from it itself. But there are no natural substances that provide the function of the thyroid gland. We need to use a drug for this disease. But what we can do is support with a little bit of iodine. We have to be very careful. With a normal hyperfunction, iodine is a good thing. With Hashimoto's, we have to be careful. Nevertheless, I suggest Lugol's solution. You can buy it in the pharmacy. This is actually a disinfectant, iodine-rich, and simply take 2 drops of it. Take 2 drops and rub it here, over the thyroid gland. Then the thyroid gland also has enough iodine to produce these thyroid hormones. And then you must treat your gut as well. I said before that this autoimmune inflammation has connection with the gut. My experience with autoimmune diseases show that the immune system is not completely off the mark. But it has a lot to do with a disturbed intestinal function, where toxins are absorbed and trigger these inflammations. Below you will find a link with more information about the intestinal function and how to treat the gut. There is also a video where I explain a therapy plan, so if you have been diagnosed with Hashimoto's disease, please look at your intestinal function and think about possible digestive problems. And if so, then it is essential to treat that as well.